vijana wana job, vijana wameingilia drugs, vijana wanakunywa pombe, vijana wanafanya violence zingine zile ambapo si poa.
Non-communicable diseases mostly is a common occurrence, especially in our country. And Langata and Kibera is not left behind. We have quite a number of cases, and especially hypertensive cases. So the risk factors, the commonest and the highest on the list is lifestyle, lack of exercises, and most of the people again indulging in alcohol use and tobacco use.
You find so many clients have existing hypertension but they don't know. So when they come for screening in the hospitals, that is when they realize they are hypertensive. So I would say it's a challenge that has not been well exploited for some time now.
If you look at the stepwise survey that was conducted in 2015, it's clearly saying that 50% of hospital admission today, yesterday and tomorrow is because of non-communicable diseases. When we began the program, we made quite a number of promises. And our promises were basically to be able to deliver a program that addresses issues of young people in regards to health, but particularly more on non-communicable diseases and the risky behaviors.
Unapokula ile chakula inastoiwa kwa mwili kama mafuta, sawa?
Looking at issues of health, our young people are suffering. So AMURT comes in now to give in that information to young people, to community members, to be empowered and to make these healthy decisions.
We have two types of diabetes. Yes?
In Young Health Program, we educate young people 10 to 24 years on non-communicable diseases. We are prepared by the three organizations which are Plan International, AMURT and the AstraZeneca. We were given trainings and we were equipped well with the information and then given a role in the society.
So throughout giving information during different platforms such as mass activities, school sessions, all of us as peer educators, we are having a school each. We are doing school gala. This is whereby the schools came together and they were doing different activities such as poetry, drama, spoken words, and also they had demos explaining how a healthy plate should look like. So they were doing different forums, the same way just giving information about non-communicable diseases.
Sometimes we could do door-to-door sessions. Sometimes we could also do one-on-one sessions. We could also organize some mass events, attract many people there and pass the information on non-communicable diseases.
When the tournaments were being held, then we'd also involve the health workers to come in and do screening. And so it was a good thing because we would get to get the numbers.
Now that we are working with young people of ages 10 to 24, if we get people of the same ages, identify young people from the community who are also good in doing these particular outreaches, capacity build them with information on NCDs, then we are sure that they're going to distribute this information to their fellow peers and the information will be widespread well enough.
Ukiangalia madhara ya sigara iko juu sana kushinda benefits, ndio? What I do is to communicate information for non-communicable diseases to our peer educators. And again, to help the coordination team to have that capacity of informing the community with the right information and also to share opportunities that are on the project.
And very easy to create a rapport, a good relationship with their fellow youth. They tend to open up so quickly rather than an elderly person. So they opened up because we are the same level. We are from Kibera, we experience the same challenges. So they openly explained what the challenges were and they are willing to talk freely.
After that, we also opened some facilities as youth-friendly facilities where we would encourage facilities to have accept the youth as they are and make sure that they attend to them.
The project has been able to be represented very well, also at the sub-county level through the project officers who have been also supporting the implementation of the interventions at the field office. We have been able to really see how young people have been able to modify the behaviors that we have been able to handle around NCD prevention.
Our HP came in handy when we really needed it because number one, they gave us resources to conduct trainings and awareness, mobilization of the youth, just to get them to know what is really happening with the NCDs. And compared to previously, we would say there's a remarkable number of youth seeking health services, and especially on conditions that they could not look for services before.
Who can tell us the meaning of non-communicable diseases? Yes, Brenda?
YHP has helped me to know how to live a healthy lifestyle in order to prevent the risks of getting cancer and other non-communicable diseases.
Life yangu imekuwa poa. Mimi life yangu imekuwa poa. Sina ugomvi kwa kieja na watoi wangu.
There's tremendous changes in terms of attitude of young people towards behavior change. We had so many young people who are taking tobacco. If you look at our midterm review, you see there's a tremendous change. The community has fully owned up and are willing to continue with the program even beyond funding.
And in fact, Young Health Program has directly reached around 83,000 young people in our community here through working with the national level, county level, and sub-county level Ministry of Health. We have developed the first ever Nairobi City County NCD costed implementation plan. We have reviewed the new school health policy. So we have achieved so much within a given short period of time, which is 5 years.
Mimi naambia vijana waache pombe, vijana wasikali laptu, vijana wapige mabiashara ziko, naona. Busy ziko, vijana wafanye tu busy.
We are really grateful for the funding from AstraZeneca to the country office to have enabled us to achieve these results.